What's New with You is sponsored by Southern VIP.
My name is Dr. Scott Osborne, and I'm with Southern VIP in Union City, and I'm here to talk to you about peripheral arterial disease. September is Peripheral Arterial Disease Awareness Month, and PAD is basically a progressive buildup of blockages in the arteries of the legs and feet that can lead to poor circulation in the legs and feet and can cause patients symptoms like numbness, pain when they walk, pain even at rest, and left untreated, it can progress to tissue loss and even amputation down the road, which can even lead to death. And this is particularly important in our area in the heartland because we have some of the highest rates of diabetes, which is one of the predisposing factors to PAD. And so as vascular physicians, we are some of the first to diagnose this. So at Southern VIP, we recognize that early diagnosis is the most important aspect of treatment of PAD. Basically, any patients who have diabetes, history of smoking, hypertension, high cholesterol, those are people that are at the most risk for PAD. And again, catching it early is the most important thing because a lot of patients can be managed just medically or with lifestyle changes and avoid any surgeries. But even those patients who present to us later that have wounds that won't heal or maybe even facing amputation, a lot of those patients can be improved and even avoid amputation with our foot rescue procedure. Yeah, so the foot rescue procedure is relatively unique in our area. Many vascular teams will only focus on the blood supply to the thighs and the calves. And really in those patients particularly who have foot wounds that won't heal, the most important thing is getting blood flow down to the foot. And so we can't ignore that area. And so the foot rescue procedure is a pretty innovative way of increasing the blood supply to the foot in those patients by revascularizing what we call the pedal loop. That's the major vessels in the foot that are needed to heal those wounds. Foot wounds that won't heal are one of the more advanced signs of PAD. A lot of the earlier signs are much more subtle, like numbness, pain when walking, pain when lying down or at rest. And to be honest, a lot of patients early in the disease process may not even have any symptoms yet. So PAD is often associated with diabetics, particularly those over 50. And so in those patients that have significant risk factors, they should definitely be getting a vascular exam every 5 years, and even more often if they have symptoms. Again, identifying it early is the most important thing to avoid those down the road complications like amputation. So here at Southern VIP, we are here to meet the vascular needs of our patients. There are many great vascular teams out there. I think it's important that patients choose the best one for them. And most importantly, I think it's imperative that those patients get somebody who is able to treat all the way down to the foot.